Hi, everyone. Welcome to today's webinar featuring expert authors Shannon Dames, Andrew Penn, Monica Williams, and Joseph Zamaria as they demonstrate the approach in their book, Deliberate Practice in Psychedelic Assisted Therapy. This webinar is hosted by the American Psychological Association Publishing. We're also offering a 15% discount on Deliberate Practice in Psychedelic Assisted Therapy using promo code APA Books Web 15. This promo code and link to the book will be shared in the chat throughout the webinar. All questions will be posted, should be posted in the chat and Q&A, and they will be answered throughout the webinar. The link to today's webinar, as well as the promo code, will be emailed to you in the next few days. Thank you and enjoy.
Hello, everybody. We are glad to see you today to talk about our book, Deliberate Practice in Psychedelic Assisted Therapy. We see a lot of people here at this webinar. So we're really, my co-authors and I are really excited to plug the book today. My name is Joe Zamaria. I'm one of the authors of the book that we're going to discuss today. It's my pleasure to kind of host this webinar and introduce you to my very talented co-authors. And we really hope to have a meaningful conversation about this method of training and about psychedelic-assisted therapy more broadly. We really hope folks will use the Q&A feature. We have some thoughts and questions planned to sort of deepen the conversation about this book, but we really hope that it's attuned to all of you who are here and who are interested. So without further ado, our agenda for today is for each of us, there's 4 of us co-authors here, to take a turn to introduce ourselves and talk about our work adjacent to psychedelic-assisted therapy. And then really the meat of today will be talking about the book, the process of using the book, what is this training method, how does it apply to psychedelic therapy, and fielding questions from you all. So again, we're really glad to be here. We have an hour in front of us. I will, one by one, turn it over to my co-authors who will take a turn to introduce themselves. So how about first, Dr. Shannon Dames? Can you please introduce yourself to our group?
Thank you, Joe. Hi, I'm Shannon Dames. Hoping everyone can hear me okay. I actually hail from Canada, Vancouver Island, from the Snuneymuxw First Nation territories. Really delighted to, gosh, I'm feeling nervous if you can't tell, but feeling honored to be here. That's where those nerves are coming from. I am a nurse by trade. I've been a nurse for over 20 years now. I also am a doctor of education, which I specialized in the core factors that promote resilience in humans, and specifically those in healthcare fields. And I got into the field of psychedelic-assisted therapy probably almost a decade ago now, very much for personal reasons, and have had the great pleasure of intertwining that in my professional life as well, both as a chair of the Psychedelic Assisted Therapy Program, the graduate certificate program at Vancouver Island University, and I also am the clinical lead for a nonprofit in Canada that provides psychedelic assisted therapy called Roots to Thrive. So I'm really glad to be here, and with that, I am going to pass it to, is Andrew here, or? Yes, I'm going to pass it to Andrew.
I'm here. Are you hearing me okay?
Yes.
All right, excellent. Hi, everyone. I'm Andrew Penn. I am also a nurse by training, a psychiatric nurse practitioner. More specifically, I'm coming to you from California, from San Francisco, which is also unceded Ramaytush Ohlone land. I am a clinical professor of nursing at the University of California, San Francisco, and have been involved with psychedelic assisted therapy through a lab there known as the Translational Research Program in Psychedelics, or the TRIPPER Lab, which is run by Dr. Josh Woolley, and have worked on a number of different psychedelic assisted therapy studies in that capacity, recently as an co-PI for the USONA phase 2 study of major depression and psilocybin. Did psychedelic training a number of years ago through the California Institute for Integral Studies, and got interested in this book project because it was clear that while there is certainly a growing psychedelic training, a need for psychedelic training, there's a sort of a lack of consistency in those training methods and pedagogy. So interested in helping to create some tools to better help future psychedelic therapists complete training. Dr. Williams, can I turn it over to you?
Yeah, absolutely. So yeah, it's wonderful to be here. I'm just so excited to see the range of places people are from around the world. I'm just looking at the chat here. It's incredible. I'm actually in Canada. I'm in Ottawa, Canada. I'm an American. I moved here in 2019 to start at the University of Ottawa, where I'm in the School of Psychology as the Canada Research Chair for Mental Health Disparities. My work is focused on the mental health of underserved communities and psychopathology research. And so this also includes work to ensure that everyone has access to mental health care, including innovations in mental health care, such as psychedelic assisted therapies. We know there's many barriers to care, such as income, education, and discrimination, but some barriers are caused by the mental health care field itself. And this includes competencies or lack thereof in evidence-based treatments. And so psychedelics are a promising new approach, but only if providers are ready to deliver this as it navigates the regulatory hurdles necessary to make it available to those in need. So I've been involved in psychedelic research for some time. I've done some work with MAPS. I've done some grant-funded studies with so many groups, but I've been very involved in Chacruna, and also, we just founded, I think, maybe one of the world's first master's programs in psychedelics and consciousness studies here at U Ottawa, which is very cool because we enrolled our first cohort 2 months ago. And I teach a graduate course on psychedelic assisted therapies for mental health. And so I was so excited to do this book because I'm like, oh my gosh, I need a textbook for my course. And I was actually able to help write that. So that's been super exciting. And yeah, I guess I'll stop there. I'll pass the baton back to Dr. Zamaria.
Thanks so much. So last but not least, I'm glad to introduce myself. My name is Joe Zamaria. I'm actually a colleague of Andrew, who just introduced himself. I also am based in the Bay Area in California. I work at the University of California, San Francisco, in the School of Medicine and the Psychiatry Department. So I'm a clinical psychologist by training, and I've been a faculty member in the Psychiatry Department in my home institution for a while. And then my work related to psychedelic space, I've worked with Andrew in the same lab and a lot of the same studies as a therapist and a researcher in trials of psilocybin-assisted therapy for a range of different conditions. I also have a faculty appointment at UC Berkeley. And within the Berkeley Center for the Science of Psychedelics, there is a certificate granting training program in psychedelic-assisted therapy. And I'm the lead psychotherapy trainer of that program. And the other trainers, the other educators represent other traditions like medicine or spiritual care. So my focus is on psychotherapy within that space. A few other things. I'm on the advisory board of the Fireside Project, which is a harm reduction endeavor. It's a call and text line for people who are having challenging experiences using psychedelics. And it's meant to spare burden on the ER and 911 and so on. And we produced some research related to outcomes, what volunteers were reporting and what callers were reporting, how it was helpful, how the existence of the Fireside Project was helpful. And then lastly, at UCSF, I teach different classes here and there about psychedelics, including a course to pharmacy students and medical students about trauma and psychedelics, and also about racial trauma and psychedelics. So that's us. That's our core sort of group of co-authors here. We're glad to be here and introduce ourselves. It does not yet look like there are some questions popping up in the Q&A. So Shannon, perhaps could you lead us off with answering a question that you formulated that might help our audience understand our book and this method of training a little better.
Thank you, Joe. So maybe just to kind of like catch the baton here, we're gonna go around. Keep an eye on the chat box if you have very specific questions, or in the Q&A area. We'll kind of hop between the ones that we formulated for those that maybe don't have questions just yet, but may have them in the future, and we'll kind of bounce back and forth between that and the chat box or the Q&A area. I'll maybe come from my frame that I'm really appreciating the diversity of the folks that are dialing in, and also some of the diversity among us authors as well, where we come from, both in land and perspective. And I'll maybe start just speaking to that piece. Writing anything, I think, is pretty challenging in terms of trying to really represent a diverse lenses and views from like an international audience, of which this work really applies to. It's not meant to be prescriptive. We have our own lens, and that is obviously going to be woven in. And it's also meant to, as a practice text, it's meant for people to kind of feel the edges of different ways of knowing, which you may or may not find as a fit for you, but even in walking down the path, I think there's some learning and kind of what resonates and how your unique practice might translate some of the learnings here. And I think that's just maybe one of my first questions to answer is just how do we weave in diversity in this? Coming from Canada, I'm mostly Western informed, so I'll speak for myself. I'm like trained in the kind of colonial medical system here. So there's a lot of that kind of view coming in. And there's also where I live, there's a lot of conscious effort to really honor Indigenous ways of knowing as well. So I try and be a steward of what that might look like and some of the flexibility for honoring other ways of knowing in that way. I bring that specifically up because psychedelic assisted therapies, even though we are kind of it's re-emerging in the kind of Western clinical area, we also just really want to recognize that they're not really new. They've been around long before us, and many of our ancestors were likely involved in them at some point in their timeline. So us coming out to it, feeling a bit new to it, I definitely consider myself a novice in this area. There's a lot of learning, relearning on how to work with medicines in a respectful and humble way, and how to evolve over time as we learn more about best practice. We're still very much in the infancy of what that looks like in the kind of Western system. And I'm looking forward to, I think, a lot of this, just recognizing the international folks even logging in here, how we can work together and kind of weave our different perspectives. So I think I'll just start there with that question on diversity, and really want to honor this is heavily, primarily like a very Western approach. And also want to recognize that might not sit super well with everyone, and there's great learning opportunities, I hope, either way. So with that, I'm thinking, should we just kind of go around, do like one at a time, bit of a round robin? Okay, I'm going to pass the ball to Andrew. If you're feeling inspired to speak to anything, question box or your own, how about it?
Joe, I think you've got a question if you want to. I don't have the list of questions in front of me, but if you would tee me up, that'd be great. And I think your mic is off right now.
Got it. Thank you. Yes, you got it, Andrew. Andrew, what disciplines in educational settings do you envision this book being used within?
Yeah, we really approach this, as you can tell from our bios, we come at this from several different perspectives. One thing that unites all of us is that we're all educators. And so we really saw this not just that psychedelic assisted therapy within sort of more of a Western medical model, as Shannon mentioned, is really somewhat more of the focus of this book. I mean, there are certainly many other ways of doing this work, which are also legitimate, but this focused on more of that kind of experiential and didactic kind of model that we have experienced training other clinicians in different modalities. And so one could think of this book as a sort of structured role play process. You know, I know when I was in school and we would do role plays, a lot of times we weren't given a lot of guidance about how to role play. You know, we hadn't seen enough patients to really know what real patients looked like, and we hadn't been doing the clinical work long enough to really know what real clinical work looked like. So it was a little bit of well-intended charade sometimes. And this book was really intended to create some structure so that what we've divided this into three different sort of silos of skills, if you will, not silos, but three different areas of skill, so beginning, intermediate, and then more challenging. And then within each of those subgroups, there are beginning, intermediate, and more challenging sort of scenarios. And the process of deliberate practice is really intended to give people repeated, structured ways of practicing clinical encounters. So rather than just sort of an unscripted role play where you have no idea what the person is going to present with or how you're going to respond, this presents a prompt for the person who's playing the patient to begin with. And then the person who is playing the clinician is invited to first come up with their own response. And then what we've created is a series of possible responses. You know, they're not necessarily the right one or the script or the one that should be followed as a script, but really as a starting place for finding your own voice as a therapist in this process. And it's really only when you have that sort of foundation of skills that you can then begin to improvise. You know, I think about if you've ever learned to play music, you know, you have to sort of learn your scales and your chords before you can start to riff and jam. And so therapy, not entirely different. You know, you've got to learn your basics before you can learn to improvise. And that's what we intended to create here.
Wonderful. Thank you, Andrew. May we pass it on to Monica? Are you ready to share something about our book? Could you share with our audience why therapists would need to learn new skills regarding using psychedelics in therapy?
Yes, excellent question. And I think, yeah, it might be tempting to say, well, maybe don't we have skills that we can use that would be good enough? And I would say you have a lot of skills that are still going to be useful, but you're going to need some additional tools too, because when you're doing psychedelic assisted therapy, there's a couple of things that are different from regular therapy. For one, clients are in they're in a state of increased emotional vulnerability during psychedelic experiences. And so we need to take more care with them. We need to have higher ethical standards. They may be immobilized or unable to articulate what they want clearly. And so, you know, and so this is something we also have to be prepared to address. I mean, if you're in a session, the client doesn't like what you're saying, they can just get up and leave. But with psychedelic assisted therapy, they may not be able to leave. So we have to make sure that that we're responding to them in a helpful way at all times. Sessions may last several hours, and for those of us who are trained for like 45 or 50 minutes, that can take some getting used to. And we may be working in teams as well. So many types of psychedelic therapies, you have a co-therapist, and that may be a new skill for people. Also, clients may have intense emotional reactions to the psychedelic substances or the insights that they experience or the memories that they unearth. Sometimes people, you know, retrieve buried traumatic memories. And so this is also going to be something that we're prepared for. I know some people, maybe not so much therapists, but I know like a lot of psychiatrists are kind of trained to like, we're going to give people stuff that's going to bring down their emotions. And with psychedelics, sometimes we want people to have big emotions. And if that's not something we're used to dealing with, that can throw you. And then also people may not feel like themselves for days or weeks after the experience. And so, so this is something that we have to be prepared for. And then also they may have intense transference towards the therapist, which may include feelings of appreciation, may include feelings of love, I have a grad student. I always know when he's doing psychedelics because he texts me, Dr. Williams, I love you so much. So so we have to be able to, you know, take that for what it is. And so these are all things that that I think require some special skills that that may not come up as much, you know, in other kinds of therapies. So.
All right, thank you, Monica. So we'll have several chances to go through some questions. I'm kind of synthesizing what I'm seeing in the Q&A and in the chat. There was a question I was going to answer, but there's also some other interest bubbling up, and maybe I can sort of weave these together. It seems like a lot of folks are interested in how to train like in this method. If you're starting out as a therapist or you're just getting started in therapy, you know, how does this live, or how is this incorporated into training? So we could try to address that question. There was one question that came up, though, that I think weaves most well with what I was going to talk about. This is from Mallet Reed, says that, is there a single underlying epistemology or theory that sort of coheres with our approach? So this is something actually that I think is really cool about psychedelic-assisted therapy. I think it's also really cool about deliberate practice, that it's trans-theoretical. Even amongst our co-authorship team here, we a lot of therapy traditions are, many therapy traditions are very well represented from kind of different corners within therapy. For example, Dr. Williams is a well-known expert in cognitive and behavioral therapies. Shannon, Andrew, myself all come from our own unique places. I love some behavioral therapies, but also psychodynamic therapy, internal family systems. These all track really well with psychedelic-assisted therapy. I think it's more about how the therapist is showing up for our client, for the client, than is it the correct approach or not the correct approach. So what you will see in our book is, you know, a lot of different therapy traditions are represented. There's a section about kind of working with transference, which is all therapists work with transference, but different therapists kind of think about it differently. But it's elevated, it's heightened in the psychedelic-assisted space. The meaning and the impact of transference, and also the sensitivity that's required to work with it. So you'll see a section about transference. There's another section about working with internal conflict. So I'm an IFS sort of oriented person, so that's the way that I think about internalized conflict, but shows up in a lot of other traditions. And ambivalence is expressed in kind of cognitive and behavioral traditions. Psychodynamic therapists think a lot about conflict in the mind. So I think if you're coming at this from basically any psychotherapy orientation, you will find this book to be useful, and you'll be able to incorporate it, integrate it into the way that you traditionally work. So I could say more, but why don't I'm eager to answer these questions. There's a lot popping up about like legality. How do you train in this modality besides just getting this book and so on? So I don't know if that's within or not within the scope of our webinar, but
I mean, I could just jump in quickly because
yes.
a lot of people are asking, like, where is this legal? And what I'd like to point out is it's already legal. People are already doing ketamine-assisted therapy all over the United States and Canada and other places. So there's already psychedelic, it's already legal and being done, not with certain substances that are not yet legal, but as those substances become legal, those will be added to what a lot of us are already doing. And then certain substances are legal under certain circumstances. For example, research studies, or you know, in Canada, we have a special access program where if people need a psychedelic substance for a condition, the doctor can fill out some forms and get permissions for them to have that. So it isn't broadly, you know, legal, but I think that's coming. And then maybe you two might have something to add around that as well.
Yeah, Monica, thank you. And I'll just say one more piece about legality. I know there's people on this webinar from all over the world, really. And so it depends very highly on the legality of psychedelics where in your locality. I can speak briefly to what it looks like in the United States. As Monica suggested, ketamine is legal, has always been legal. It's a regularly used medical substance. So ketamine-assisted therapy is not difficult to come by in the United States. With other substances like psilocybin or MDMA, we have to look at what level of legality we're talking about. Is it FDA approved? Is it legal at the federal level, at the state level? Is it decriminalized at a municipal level? And what are the implications of these different levels of legality? For example, our training program at UC Berkeley has reciprocity with the state of Oregon. In the state of Oregon, you can apply through the health board for a psilocybin facilitator's license. You don't need a graduate degree, you don't need a healthcare or mental health care license, but you do need the appropriate training to get that license from the Oregon board. So we have reciprocity with the state of Oregon. If people complete our program at UC Berkeley, they can then go practice in Oregon under the auspices of the Oregon Health Authority at the state level. Using psilocybin outside of a research context, outside of an FDA-approved research context, is still illegal at the federal level. So it's complex in the United States. It's important to see like where you live, what's true at the city level, the state level, the national level. If you live in the geography outside of North America, it would be important to know just what that looks like there. Okay. Lots more questions popping up here. I'll turn it back to Shannon. And Shannon, let me know if you want me to tee you up with a question or if you got it.
I think I got it. Yeah, thank you. I'm trying to weave with the questions here too, and I wanted to talk a bit about the approach and how, as I think it was Joe who was mentioning it, we really try and make this a bit trans theoretical so that it applies to multiple approaches and even diverse ways of knowing. And one of those that there's a pretty heavy focus on the somatic approach, and what I mean by that is like the impact on the body, with the idea that we as humans, we all have bodies. We talk a lot about integration and what does it mean to integrate the learnings that we might get in a session or the insights that might come through. And that integration is a big part of that, is moving it from the mind of like, you know, the story that may have emerged, and how do we live that out in our intuition, in our behaviors, in our value sets? Like, how does that translate? That would be considered integration or embodying the insights that come through. And that's why you'll notice a lot of the text and the practice, and it's really good practice for many of us who've been trained in the West, that are very trained at the level of the mind. You know, we know how to analyze and put puzzles together up here, but when it comes to actually integrating and embodying insights to where, you know, our day-to-day life changes because they are woven into our belief systems in the body or the somatic senses. A lot of psychedelic therapy, that's really a key part of it, is moving it at like we call it kind of the default mode network on the Western frame, where these medicines kind of take off or they quiet the regular default patterns that we tend to operate through, or the default stories that are kind of running our lives. Those get much quieter in psychedelic therapy, and new perspectives, storylines, and even like a renewed connection to our values and what matters to us are heightened. So there's a real opportunity when these insights and these connections are kind of coming together to make change that might be actually very difficult through a traditional kind of talk therapy modality, where the information might be here, but there's a lot of frustration because the behaviors aren't changing. So that's why a lot of this book, some might consider it a somatic approach, but it's really meant to be just an embodied approach. How do we move from the mind to the body? I'm going to weave into, there's a question about kind of the religious, spiritual aspects. We really leave it quite open to however the participant is meant to be driving the conversations. So we as psychedelic assisted therapists and in the role plays, it's really about trying to help them dig a little deeper into their own belief systems, right? So that integration, that translation is coming through them. And we're just kind of holding space or creating a container that allows those to flow. Yeah, so in that way, I think there's a lot of potential when we're trained in this way to really be more of a space holder rather than a guide that's kind of bringing them along a path that we might have worked for us. It's a little more skillful in the way of learning how to take a bit more of a backseat. And, you know, for example, if somebody's having a big experience, rather than maybe asking about or analyzing the story of that experience, we might say something as simple as, where are you feeling that in your body right now? Right? So it's just really helping them land in their body and really sink into that experience in a more somatic way. And that is a common thread throughout these exercises. So I think I will leave it there and either pass back to you, Joe, or head over to you, Andrew.
I'm not sure if we lost Andrew or not, but I could answer a question, or I could turn it over to Monica, and then Monica could hand it to me. Andrew, if you're here, please speak up. But otherwise, I'll prompt Monica to go next. And then Monica, would you like me to tee you up with some questions that are
Yeah,
bubbling up?
what's a good question? Based on, there's so many.
Well, a lot of people are asking like really foundational questions of, is this therapy effective? Is it legal? Is it risky? Who is it good for? What's the difference between ketamine and psilocybin and MDMA? These are excellent questions, and I just wanted to state that I don't know if our book or this webinar will necessarily answer those questions. I don't think of this book as like foundational, what are psychedelics 101, but kind of a one step beyond that of like, if you have an understanding of what we are talking about, we're talking about psychedelics and psychedelic assisted therapy. It's a way to dip your toe into practically training. But it sounds like a lot of people have some really good questions about foundational questions about what is this? What is psychedelic assisted therapy? What are psychedelics? So if you feel like fielding that, Monica, you could, or I could give you something that's more in line with our purpose here. It's up to you.
Sure. I mean, I would say, I guess one question that I see is like how effective or what's the success rate of psychedelic assisted therapy? And I think it's really hard to just answer that question flat out because there's lots of different psychedelics that might be used for many different types of problems that people may have. And then sometimes people may have several different mental health problems. And so just like any therapy, the answer is it depends. But I can definitely say from my own experience and from the research we know, I can say that most of the people that I work with at my clinic, I see that it benefits them a lot. There's always a few people that maybe don't get as much help from it as you would hope. But there's also a great number that have really sort of amazing turnarounds in their symptoms. So it's hard to answer it like that. It's hard to answer with a specific number, but we know, for example, that, MAPS did a study of looking at MDMA specifically for PTSD, and they had very high rates of people who actually lost their PTSD diagnosis, who actually improved as a result of that therapy. So, I think the number was, what was it, like 80% at follow-up were improved. So we could say what was very effective for that group of people, but there was a specific group of people in their specific circumstance, and it may or may not be that effective for the average person with sort of the average mental health problems. But there were some questions about what sorts of, is this dangerous? And I would say that psychedelics are a powerful substance. And so, any powerful substance, there's going to be some dangerous aspects to it. But the things people are worried about are actually not the things that are dangerous. They're not addictive. That's the biggest one people worry about. Chances are you're probably not going to drop dead if you take it. Even if you take too much, you'll probably be okay. You probably just have a really weird experience. So those kinds of things, those kinds of risks are much, much less than people tend to think. Really, I think the bigger risk is to taking psychedelics without being in a safe place, without having the support that you need, and without having the proper support afterward, because isn't always predictable what comes up. And sometimes you have a great experience and you see rainbows and unicorns, and other times you have an experience that could be described as traumatic, and you need to process that and work through it. So there's an unpredictable nature to it. Gosh, I was going to say more, but I think I'll stop there and let you guys jump in.
Thank you, Monica. I think if it's all right, I'd like to field an adjacent question that seems to be coming up too. Some people are asking, like, how do you administer this therapy? What does it look like? And so there's nothing I could say in a short amount of time that will help you feel totally equipped to do that. So it takes probably years of study and training, and I think our book could be really helpful, or training programs that offer robust training in psychedelic facilitation can be really helpful. What I will say is this, and this also kind of is meant to address the question of ketamine or psilocybin or ibogaine, 5-MeO-DMT, MDMA. There's all these. There's a more liberal or more conservative definition of what are psychedelics and how they differ. But I think something that is a common thread across good psychedelic care, and it also is sort of the way our book is structured, are the phases of treatment that are necessary for good psychedelic administration. So it's never the case that we're meeting somebody for the first time and that's the day that they're ingesting a psychedelic medicine. Usually there's substantial time. I've worked primarily in research contexts, so I can tell you what it's looked like in research spaces, but we'll have at least 6 or 8 hours with a patient before they're ever ingesting any kind of psychedelic in our presence. And the purpose of those preparation sessions are, of course, to build rapport. So for those of you who are therapists, who are psychologists here on this call, you're familiar with the process of building rapport and you see how crucial it is to effective psychotherapy. The same is true with psychedelic-assisted therapy, probably even more so. And I think we would see this across substances. There have been good papers published in the last couple of years showing the impact of alliance and rapport on outcomes, both with MDMA and with psilocybin. So those prep sessions, we're helping patients to formulate their intention, like what they're hoping to get out of this whole arc of treatment. We're building rapport, we're taking history. We're also going through some logistic stuff, like where is the bathroom? How do you walk to the bathroom when you're under the influence of psychedelics? What level of touch from your practitioners to patient is acceptable to the patient and to the practitioners. So we're contracting around those sorts of kind of ethical boundaries and things of that sort. There's a middle phase where we are actually administering a psychedelic. In the research space, this looks like somebody showing up to the clinic early morning, a little bit of a bustle as they get some assessments done and get ready and they kind of ground in the space. And those are usually all-day sessions where we're supporting somebody in their experience. And it could look pretty different depending on the drug or the dose. And then the final phase, the integration sessions. So these are more conventional psychotherapy sessions. There's no drugs involved, where the therapists and the patient are meeting and first maybe trying to make sense of or process the psychedelic experience, and hopefully eventually translate that into something that will affect change in the patient's life, that they can bridge from a great insight that they might have had under the influence of psychedelics to a change that they're going to make 6 months out, a year out, 2 years out. They're still engaged with that process, keeping that process alive in a sense. So I just wanted to say that's a little bit about the structure of treatment. Our book kind of loosely follows that frame. And I think that framework makes a lot of sense and a lot of contexts with a lot of different types of medicines, not just ketamine, not just psilocybin. Okay, so that's the question I wanted to answer. Shall I kick it back to Andrew, since I think you're on deck, Andrew? Do you want me to, and I'd be happy to tee you up with one of your questions.
Yeah, so sorry to drop off like that, y'all. Psychedelic therapy sessions often come with unexpected events, as do psychedelic webinars, like your phone deciding to break up in the middle of it. So apologies for that. Yeah, Joe, what was the question that you had for me?
So actually, you had formulated a few, and there's some interesting ones kind of popping up on the Q&A too. I'll give you yours, and I'll see if I can synthesize one from folks' questions too. So Andrew, why not just let students make up their own training role play scenarios? You were talking about role play and the function it serves in training and what it looks like and can feel like sometimes, but why have this practice be scripted in this way rather than more off the cuff?
Yeah, so really the idea here is, I mean, you could, to continue the extension to music, we all sort of think we know what music sounds like, but if you sat me down at a piano, I would probably just make a lot of noise. I need a little bit of structure given to me in order for me to begin to understand how music works and how chords work and what notes go together and what notes don't. And so I think, to extend that metaphor to teaching, there is a parallel there in that students, especially when they're very early on, they haven't had a lot of clinical experience. And presumably most of the people using this book will not have had a lot of experience in doing psychedelic assisted therapy modalities. And so the idea is give people a little bit of a starting point. But I want to be really clear that the point of this method of deliberate practice is not to learn a bunch of lines and then repeat them kind of robotically. I mean, that would be terrible. Let me be very clear. This is not about having kind of a regimented approach to what one says back to a patient, but rather developing enough skills and getting the familiarity, kind of developing the muscle memory, if you will, that when the time comes to actually do this work with real patients, you've got some chops, to continue my musical metaphor here. You kind of can read what's going on and go from there, and to improvise and be creative. And that's, to me, that's the fun part of therapy, is not following a script. But I didn't get there. I wasn't there at the beginning. And the presumption here is that most students using this book would also not be there. And so we give people a starting point, give them some guidance about where they might, how they might respond, and then let them work with their instructor to find what feels right for them, to find their own words, and to find their own style for doing this.
Wonderful, Andrew. Thank you. There is another question that popped up on the chat that I think would be worthwhile to answer. And I think this could go to either Shannon or Monica. So I'll leave it to you to, Shannon, you're on deck, and I think Monica would be very well suited to answer, both of you would be very well suited to answer this. This is from Asha K. Brown. The question is, hi, you've named the issue of access for a diverse clientele. Does the book include practice examples that may prepare the practitioner for situations unique to marginalized people, people with collective trauma histories, etc.? So, Monica or Shannon, I don't know who feels like fielding that, but I think you both.
The answer is yes. In fact, we have like a whole section on cultural considerations in racially and ethnically diverse communities. And also there are many examples and themes of different types of marginalization sort of woven throughout the book. So so we absolutely address this. I mean, no, this will not, the book itself is not going to make you an expert in culture-informed therapies. You should hopefully come into this with a little bit of that already. But it's certainly included, and I would say, well embedded in the approach that we take.
Yeah, thank you for taking that, Monica. I think what I would say is like how we frame it in the book, and I believe actually in that chapter we say there's a bit of an expectation that people already have a floor coming in. So if you're feeling like that whole kind of cultural competency, safety, humility areas is one to shore up, it would be good before getting into the role plays. So you can actually translate that into the practice environment. One of the key focuses is really just around curiosity. We cannot, I think when we start boxing people in, like making a bit of a pre-judgment around where people might fit in that way. For me, sometimes I think that's where I start making mistakes, really, because I'm making assumptions about where I think somebody, who I think they are, and what I think their belief systems are. And a lot of what we're trying to do is actually ask. And if something comes out of our mouth that doesn't land very well, because we might come from two different perspectives, is taking the opportunity to dig a little deeper, not necessarily for us, although there is some benefits as we kind of learn how to navigate these things, but also to like kind of what Joseph was talking about earlier around like transference, or like recognizing that stigma and racism, discrimination, many people, these are a form of trauma for many people, and that if some of these incidences kind of activate what may have been a traumatic event from the past, and it kind of comes into the room in the present moment, rather than kind of looking at it as like a game stopper, reverse course, and it's really starting to lean in a little bit to where is that coming from? Tell me more. So yeah, it's more of a humble approach, a learner, us as learners approach, so that they're kind of driving that bus. I wanted to, maybe before I pass on as well, just recognizing a lot of the questions are kind of foundational psychedelic assisted therapy questions, which this book doesn't really cover in terms of like what is psychedelic assisted therapy at a more complex, more depth. We really, this book would be more for professionals that have a lot of that theoretical knowledge under their belt already, because we don't dive into a lot of psychedelic assisted therapy theory, or even, you know, therapy approaches. We expect that if you're kind of going down that road, that you've already kind of done that work, and this is the opportunity to translate it into practice. So it's kind of like theory already done, then you're ready for this book. You'll notice as we were kind of checking in here that each of us is involved in a training center of sorts, or kind of provide some of that more theoretical knowledge. And this book is more along the lines of bridging to practice. So like as people are heading more toward like a practicum or supervised practice, this helps get them ready, but would not be a place to start. So I think that's a really important point to note.
Thanks, Shannon. I think that dovetails really nicely with another question and sort of theme of questions that have been popping up here. The question is from Mary. I'm not sure if it's Catchell or Cachell. Mary's question is, it sounds like this book is for individuals who do not already have experience with PAT, either personally or professionally. Am I correct? So what I would say to that, and I think it's talking on some other people's questions too, about how do you get started, how do you get training in this and so on. I don't think it's not for people there's too many double negatives there. I think this book could be for people who don't have experience personally or professionally with PAT, but are starting from sort of square one. I think it could be really useful for people who have a little bit of experience in the space too. The whole idea behind deliberate practice is these exercises are sort of scalable by skill. So if you're a complete novice, I could go through some of those exercises myself, and I would find them useful if I toggled and found the right degree of difficulty. And within the deliberate practice framework, there's a rubric, there's a way of doing this where you're kind of having the learner assess how comfortable, or if they're well within their comfort zone, maybe they could stand a little more of a challenge. If something felt like a struggle or really anxiety provoking in the role play, maybe scaling it back a little would be find that optimal zone of learning and development. So I will say, yeah, I think it could work for people who do not have experience with in any way with psychedelic assisted therapy. The question that dovetails to that I think other folks are asking here is, how do you get started if you're a clinician? How do you get started if you are a researcher? Here's what I would think to do if I were a clinician is try to take in as much, if you're coming from a complete, like a place of, if you're coming as a novice towards this field, take in as much information as you can at a foundational level. Some people are asking about some good books. I know that APA is going to publish a handbook forthcoming related to psychedelic assisted therapy. I've contributed a chapter to that book. So that would be one place to start. It's not out yet, but there's a lot that is out there. I think for some people, if it's appropriate, if there's legal and safe and affordable ways to experience, let's say, ketamine-assisted therapy for some of you, that's not a bad way to understand what your patients might be going through as well, but that also may not be for everyone. I would recommend it, actually, but, and so, yeah, and I think if you're still in graduate school or you're still training in whatever is your profession, it's a good time to experiment a little bit. Learn what is your profession, if it's being a psychotherapist or a psychologist or something else. Learn that really well, and then try to, adjacent to that, develop your own personal ontology about what are psychedelics, what do they mean about mental health, how does that weave into your emerging sort of psychotherapy framework. And I think for researchers, I think it could be of value to look at this book. In particular, I've worked with a lot of researchers in the research space, and a lot of really smart folks who have written great studies, but they also, depending on if they are a clinician or not, don't know what it's like to be in the room with a patient who's experiencing psychedelics or going through this arc of treatment. So if you're a researcher, it will be a very robust way to familiarize yourself with a lot of the dynamics that could come up in the research space or any space where PAT is administered. Another way I think researchers could get involved is to partner with faculty at your institution or local institutions or not even local institutions. Maybe they have a need that your skill set can provide. If you're a great qualitative researcher, maybe you can volunteer to help them with one particular aspect of their project, but then you're now sort of getting acculturated to that space, and you'll presumably have some contact with the therapists and the clinical team and the research team and so on. And so that's one way to get started. I could say much more. I'm saying a lot, so I want to turn it over to who's next. And so it just came from Shannon to me, so maybe back to Monica. Does that make sense?
Yeah, I mean, I noticed one question that's come up a few times is like, how do you deal with stigma that may come up around this, or have we had to deal with stigma? And, and I would say personally, it's probably been a lot less than I thought when I became a psychedelic researcher. I thought, what are people going to think of that? And most of them are just like, cool. So that's been nice. My dean, when we started the master's program, she's like, this is fantastic. I'm going to be the dean of psychedelics. So I didn't see that coming, but I was happy about it. There's always some ignorance that you have to push through. There definitely are people in my own department who didn't like the idea that we were going to be doing this and thought it might make us look bad. And I just responded with the research. I'm a researcher, and that's really what got me interested in the field, is seeing the research. And I said, well, what does the evidence say, right? And so, but I would love to hear from some of you as well about maybe things that you've had to overcome as psychedelic researchers.
Thanks, Monica. I think Andrew next. Andrew or Shannon. I can't. I'm a little out of order now here.
I think it might be you, Andrew.
Okay.
Let's hear it. What you got for me?
So let's see. I'm actually going to scan our Q&A because there's just really wonderful questions in here.
Joe, while you're doing that, I just want to put a finer point on something you were saying earlier. I want to be clear that this is really intended to be a textbook. This is not a how to teach yourself how to do psychedelic therapy book. So this was written with the intention that there would be an instructor involved who would be able to be part of the feedback process. So this isn't a self-learning how to become a psychedelic therapist book. I think people that bought it, if you were to buy it expecting that, you might be disappointed. But really, this is intended as a somewhat technical book and really as a workbook to help people practice these skills within the setting of an educational setting where you've got a trainer and you've got somebody who is familiar with this modality. So just want to be clear about that.
Thank you, Andrew. And here's a question for you. So lots of folks seem to be interested in this. Let me see if I can find
lots of questions. They get lost quickly.
Yeah. Well, Andrew, there's some questions about risk. I think maybe our learners would be, our audience here would be curious to know a little more about how we mitigate risk as facilitators, as therapists in the space. Surely there's ways we mitigate risk by screening out people who are not appropriate for treatment or who are on a medication, which might be a contraindication for treatment. But could you speak a little bit about what are some of the ways that we act as essentially therapists in the space to help people have as safe an experience as possible?
Yeah, so once that the preparation really sets the stage for a better experience. As I think Monica was saying, a lot of people who have had psychiatric treatments are familiar with the idea of kind of quashing symptoms and making emotional experiences less intense. Psychedelics can be a little bit unpredictable, but one of the things that's sort of predictably unpredictable is that they do tend to intensify emotional experiences. And so when they are used in this sort of therapeutic context in particular, what we are hoping to equip people with through the exercises in this book are skills that allow them to navigate those in a way that are at very least atraumatic and better still therapeutic. So, if somebody has a strong emotional reaction in the therapy room during a drug administration session, we want to equip people with the skills to be able to respond to that in a way that will help the client have the best outcome, and to have the clinician feel like they have some competency in what they're doing. Because that also is part of the sort of special sauce here, if you will, is that the client is often in a very sensitive state under these dosing sessions. And one of the things that they're picking up is, does this person know what they're doing? Do I feel comfortable with this person? Do I feel safe with that person? And that's broadcast in many different ways, of course. But one of the ways that we broadcast that is feeling comfortable in ourselves as therapists as we respond to these situations that may arise during a dosing session. So that's really what partially what the book seeks to do.
Great, thank you, Andrew. So everyone, we have less than 4 minutes left in this webinar. Shannon, I'll turn it over to you if there's anything you'd want to say. I can also speak up too, just in close about this webinar and about our book. But yeah, I'll turn it to you.
Thank you. One of the things I like to remind myself in this work, and this has been, I think, one of my biggest gifts in this field, is this idea of coming into relationship in a different way. And my understanding what that means when I say coming into relationship with my body, and that a lot of this with the somatic approach is really kind of helping people come back into relationship with their body in a way that might have been relatively disconnected previously. Coming into relationship with this field, like really understanding the theology, the ontology around where this comes from, even beyond the Western approaches and like what we're really building from, the shoulders we're standing on, so to speak. And I think that's where a lot of the idea of this book isn't really meant to provide that. And I really encourage people to kind of get into relationship with those sides of this field. Which also helps us kind of address some of the stigma that's out there, is really understanding it is actually evidence informed, it's culturally informed, it's historically informed. And the more we're in relationship with that knowledge, the more we're able to kind of carry it as kind of like ambassadors or stewards and build the field from a place of credibility. This book and the practice that encourages is also about coming into relationship in a way that we enter into this space in a more confident way with our clients, our participants, so that we're not bringing our own kind of nervous energy into the field, but we really are able to kind of be a strong, secure pillar in the work. And that this practice is about kind of helping us get there as well. So it's and that would be the kind of coming into relationship with our own unique practice and how that translates in this field. So I think from there, Joe, did you want to kind of add anything else around? Yeah, we're really just here to kind of come and share information. And I know there's some information kind of in the front around promo codes and that kind of stuff, which is actually kind of beyond our expertise up here. So I think there will be an email in the after fact. It was a recorded session, and that is going to be available after the fact for sharing or reviewing as well. So I think I will leave it there. Really appreciate you all coming today. Meeting you in a bit of a digital way, but yeah, real pleasure and honor to be here.
Same, thank you, everybody. I know we didn't get to all the questions, but we're enthused that there's so much eagerness and interest. And if you have a little interest in our book, we hope you'll check it out and that you'll find it useful.
Yeah, thank you all for coming.
Right. Thanks everyone for attending. And as a reminder, the link to today's webinar, as well as the promo code, will be emailed to you in the next few days.